I think the biggest benefits that we saw through Perfect Week were reduced bed occupancy, being focused on the patient, placing the patient in the right place the first time, reduced long length of stay of patients, and also just prioritising the patients so that they didn't stay in hospital unnecessarily for prolonged periods of time, discharging them back home, bringing them back to maybe an outpatient facility. Patients did also benefit through the greater collaboration between clinical teams and operational teams. I think perhaps clinical teams became more aware of the capacity constraints, which then ultimately does impact on our patients. So there was perhaps greater involvement in how the clinicians could impact on capacity. Our aim was to try and get patients home earlier in the day to try and prevent discharges during the out of hours period, which is never safe for patients and for care agencies who provide support thereafter.
Engagement was led very much from executive level downwards, and we had champions that supported ward rounds and were visible leaders on each of the wards, and encouraging the principles behind the Perfect Week or the Reset Week, and share data with our staff to show them what were the main principles behind why we wanted to initiate the Perfect Week. An example of what we did that week was in improving our time of discharge. We demonstrated that we had very late discharges, but one of our objectives was to bring our time of discharge forward. Again, principle everyone knows is right, but we managed to demonstrate with our staff's engagement that that actually could be delivered. So rebranding Perfect Week was in essence the success for our week. We renamed it Reset Week, Ready Steady Flow, with a very clear narrative of what we wanted to be the outputs and what we expected to be sustainable outputs as well.
I think the top tips for running a tactical Perfect Week really are keep it simple, engage with your clinical teams, develop a culture for change, involve the whole healthcare community, and key thing is communication. Clinical teams are really important with Perfect Week. They can do peer reviews, they can relaunch their professional standards, they can look at stranded patients, they can use early warning scores, look at the resources that they've got and relaunch what they already do.
Ask and offer sessions are a really important element of Perfect Weeks. They're sessions that you would run as a team and people would say, I need help with and I can give. So it's that, teams working together to find solutions to improve care for our patients.
The key things about measuring the success of a Perfect Week is pre-deciding beforehand what the metrics we're going to use, and I think you need to decide on patient-focused metrics that are easily measurable, repeatable going forward, and therefore applicable once the Perfect Week is over. I think the key thing about gaining commitment and engagement from clinicians is by providing them sufficient warning, explaining the purpose of the week, explaining the methodology that's going to be used during the week, clearly outline the meetings that are going to happen during the week, and explain the fact that by engaging in such processes, we can experiment in order to improve patient flow and therefore allow clinicians to work in the best way they can possible.